It was a magical mystery ride of the ACA that year. So when I applied, it was in the heat of the presidential election when health and health policy was above the fold every day in the newspaper. It was a very hot election issue. And Obama won, promising to make serious changes to the healthcare system, and I wanted in.
We were finally going to do healthcare reform. So anybody who was anybody in health policy wanted into this fellowship program.
I remember Marie telling us when we were the finalist group that it was the largest group at the time they'd ever had to review. I think usually they said they got about 45 applications. Our year they got 90.
There's never been a cohort that large. So the foundation that funds the program gave the Academy more money that year to increase the number of fellows because they knew it was a deluge. So we call ourselves the Noah's Ark class. So there were 2 nurses, there were 2 dentists, there were 2 pediatricians, there were 2 internal medicine docs, and there were 2 sort of other healthcare professionals. So it was a great year to be a fellow.
When I got on to Capitol Hill, which was January of 2010, both the House and the Senate had passed their versions of what became the Affordable Care Act. But there was a special election that was going on to fill Ted Kennedy's seat in Massachusetts, and it was largely and widely assumed that there would be a Democrat to fill that seat, that the Senate would maintain its supermajority, and that they would be able to reconcile the 2 passed bills fairly easily.
There was a special election towards January 19th of that year of 2010, and surprisingly, a Republican won the seat, which meant that the Democrats no longer had 60 votes in the Senate. They only had 59, and the magic of 60 is that you can stop any filibuster if you have 60 votes, but at 59, the minority party, the Republicans, could filibuster all they want and nothing can get done.
It really created opportunity for us to really learn about what the political options were to be able to pass this legislation, because Plan A had gone out the window.
The challenge of those many 24/7 days and weeks up until passage in March was to find a narrow passage of compromise and strategy to get enough votes to pass it through what's called budget reconciliation, which only required 51 votes in the Senate.
It was really amazing to be involved in all of the negotiations on how essentially the Senate would pass the House version of it, which again was what ended up being the Affordable Care Act, or Obamacare, which was not what everybody had hoped for. They really expected that they would have a reconciliation of the 2 bills, and then each chamber would be able to pass that reconciliation, but that was no longer possible after the special election.
When the Affordable Care Act passed in March, the other thing, and I remember this because I was the junior person there, they handed me the bill, and said, go through and underline all the places that say evaluation and research, because those are ours. That's what we're in charge of. There were 500 something of them. There's a lot of them in there. That just led to a lot of discussions, and ASPE was a really good place to not only watch them reconstitute this office that had been decimated, but learn about how the pieces and parts of the Affordable Care Act were going to be parsed out to all the different sections and divisions. The Affordable Care Act asked us to do things that had never been done before. And so the big questions were, do we need to stand up new divisions? Is there an existing element within HHS that can do that? Just a lot of nuts and bolts implementation stuff. So it turned out to be really interesting from that standpoint.
I actually led the writing of the legislation that turned into the funding mechanism for the Patient-Centered Outcomes Research Trust Fund. A lot of the words that are in that, they just did a a replace for comparative effectiveness research with patient-centered outcomes research, and that was it. Even the dollar amounts involved were what we had proposed back in 2007. So that's exciting, and there were other things that ended up in the ACA that we worked on as well. I'm proud that we made that ongoing contribution.
The crucible of the passage of the Affordable Care Act really was an amazing experience to be able to share, not only with those 9 other people, but the opportunity to be there when history happened was pretty amazing.